Is coffee an accepted drug / addictive substance? Coffee is considered an accepted legal psychoactive drug. A medicine or other substance which has psychological effect when ingested or otherwise introduced into the body. Addictive substance. A chemical substance with significant potential for producing dependence. This includes any type of medication or chemical that could lead to addiction. It targets the brain's reward center and can result in substance use disorder if misused. Coffee has caffeine, and caffeine does exactly that. It stimulates the central nervous system. It increases alertness, focus, and energy. It reduces fatigue. It can affect mood, heart rate, and sleep. And when paired with other substances, it can become addictive. So by definition, caffeine can be classified as a drug. So why is it socially accepted? It's legal worldwide. It has a long cultural history. The benefits are clear at moderate doses, focus, and performance. The risks are generally low when used responsibly. This puts caffeine in the same category as nicotine and alcohol, all of which are psychoactive drugs, just with different risk levels. Is it addictive? Well, you can develop tolerance, so needing more, and you can also develop withdrawals. That's headaches, fatigue, or irritability, but it doesn't cause severe addiction pattern seen with drugs like nicotine, alcohol, heroin, cocaine. Coffee is a drug, but one that society has decided is acceptable, manageable, and useful when used in moderation. This will depend on the dose, the person, and the timing. For most people, moderate coffee intake is more good than bad. It's good that it improves alertness, reaction time, focus. At times, it has been linked to lower risk of depression. It increases physical performance. It can help with fat burning. It improves endurance and strength. At times, athletes are recommended to stay within a specific amount when doing activities. That's why caffeine is one of the most researched performance enhancers. On the other side, caffeine can increase anxiety, jitters, and heart palpitations, especially in people who are already stressed or sensitive. It can disrupt your sleep. Caffeine blocks adenosine. Even having coffee 6 to 8 hours before bed can reduce sleep quality, and poor sleep can lead to worse mental health. It can lead to weight gain, cravings, or have an impact on the food choices or the food that you normally choose. I'm pointing you in the right direction if you're wondering about sleep. It can raise your cortisol levels, and daily heavily use can lead to dependence. Skipping it can lead to headaches, low mood, and fatigue. But this is only temporary. The longer you do it, the more you lose the dependency. So dose does matter. 1 to 3 cups a day. Benefits usually outweigh the risks. More than 4 cups a day. Some side effects for a lot of people. This will depend on the individual. That is, also genetics play a role. Timing matters, and this part is very underrated. What is the worst time to have coffee? It's the time that we mostly have our coffee, morning. It is recommended for mid-morning. That's an hour to an hour and 30 minutes after waking up. Waking up and getting off the bed, not waking up and staying in the bed, doom scrolling an hour to 2 hours and then having a coffee. As well as early afternoon, around 2 or 3 p.m. It is really important that people with anxiety disorders, high blood pressure, especially if uncontrolled, poor sleep or insomnia, having acid reflux or a sensitive stomach, be mindful of your coffee intake. Coffee is like a tool. When used intentionally, it can be helpful. When used automatically or excessively, it can be harmful. There's no such thing as a bad drug. It's how, when, and why we use it. So just remember to take care of your body because it is the only place that you have to live.